Chairman Paulson, Ranking Member Heinrich, and other members of the committee. This is a great honor for me to be here on this side of the dais. I'm a former Senate staffer and career in health policy, but I'm coming to you today kind of bringing all of those worlds together, and perhaps most importantly as someone who delivers care to over 1,000 patients as part of a regular community-based primary care practice. And so that's actually where I start from. And the one thing I would ask you on this very important topic about bending the cost curve is to really consider what I would say should be all of our North Star. That is, how do we make care better and less costly for all Americans? So that's where I come from. The majority of my patients are primarily insured by either Medicare or Medicaid, and do have commercial insurance as well. So I take care of kind of all gamuts. And I want to tell you about one specific patient just because she will ring true probably to all of you on some level. 47-year-old female. I did get her permission, not her name, but I'm going to share her story. 47-year-old female, actually works for the federal government, has a high deductible health plan and a health savings account, 3 children. Average income is about $63,000, and so she's right in that ballpark. She was unfortunately diagnosed with a very complex kidney cancer that fortunately has a very advanced immunotherapy that can actually target her cells, but costs about $150,000 per treatment. No question that this is something that I think American innovation has brought to her doorsteps. But she will regularly use this very advanced medical device with me, one of her 14 doctors, to try to understand what test does she really need. What is it that she can actually get on a weekly basis in order to make sure she can afford the very expensive drug that she absolutely must take, but then she'll sit and bargain with me over which labs tests does she need, which doctor's visits does she need to go to. And these questions are exacerbated at the end of the month when she's looking to next month to think about paying for her rent and thinking about putting food on the table. And this is somebody with a health savings account. When I asked her, when I talked to her in preparing for this hearing, how does that HSA help you? And she said probably the most profound thing that I want all of you to take home. She said, it really doesn't matter whether I have an HSA or not. She said, I have to think about the money that I have to spend in that moment and what I have to do or not do in order to make that work for my finances. So I want everybody to kind of take a broader view and think about the growing cost of care and also what people do. They don't hear HSA or pre-deductible. They just think about the money that's being asked of them when they get the call from their pharmacy or when the person in my front office desk asks them for their payment at the time of service. And all of us have been to the doctor where we see that sign that says payment requested at the time of service. And that $20 adds up when you're dealing with these types of illnesses. So I come to you in that context, and I think that the conversation around bending the cost curve is absolutely the right one to have. I just want to make 3 points about the drivers of those costs. Number one, hospitals. Hospitals, one of whom I work for, hospitals have year over year had double-digit cost increases. And these increases have been held constant no matter what your payer is. Number two, ambulatory services. Costs in ambulatory services, physician offices, have increased 71%. As a primary care doctor, I would tell you that's a good thing. We should be spending way more money in high-value services, but we're not. We're spending them across the board. The third is prescription drugs. Prescription drugs, from a recent Office of the Inspector General report, has grown at a proportion, and one statistic that I'll actually read to you because it's startling. Total reimbursement for all brand name drugs in Part D increased 77% from 2011 to 2015, despite a 17% decrease in the number of prescriptions for these drugs. So less actual prescriptions, higher actual reimbursement in Part D. These are not facts to be ignored. So these are 3 huge cost drivers. I've included some, Senator Kennedy's time taught me that graphs are always wonderful to have, so I've got some graphs in my written testimony that illustrate some of this in, I hope, a very clear way. Those are 3 huge cost drivers. That's not to say that health savings accounts can't play an important role. Absolutely. Innovative services like direct primary care, having access to chronic management services pre-deductible so that you don't even have to think about whether you need to spend an HSA on kind of higher value services, work that the University of Michigan has done to identify what's high value. opioid treatment, for example, should not apply to your deductible. I don't care what you're doing. These are things that just make sense for everyday Americans, and we need to do more of that. We started some of that by making preventive services covered before deductibles in the Affordable Care Act. That was not enough. So in closing, I just want to, I know that we'll get into hopefully an extensive kind of debate about health savings accounts and what fixes. Think about all of this as kind of a large balloon and think about the real people and the real voices, particularly of patients, as well as the doctors who are taking care of those patients who are just as frustrated. And I hope that we can have a more productive conversation. Thank you.